It's a rare disorder of the blood vessels in the brain. It has an unusual name and a unique way to treat it. Meet a young mom diagnosed with a life-altering disorder and the doctor who helped get her back to life. And good morning. It's Tuesday, November 15th. I'm Jessica Lovell. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio this morning. Today, we introduce you to a young woman who had a stroke and then was told she needed to undergo brain surgery to help prevent it from happening again and possibly taking her life. So make sure you get your questions sent in to us on YouTube, Facebook, or email those to the Medical News Network. You can find links to those there on your screen. But first, we're making our morning rounds. A Food and Drug Administration advisory panel voted to approve a two-drug combo inhaler for adults with asthma, but they rejected it for younger children. We are joined now by allergist Dr. Selena Geer. Good morning. How are you?
Good morning. Thank you for having me.
Always good to see you. How is this different from the current inhalers that are out there on the market?
It's a great question. This inhaler makes a combination of two medications commonly used for asthma. The first is albuterol. It's a short-acting medication that is used to open the airways that are narrowed or constricted during an asthma exacerbation or during asthma symptoms. The second is budesonide. It's an inhaled topical corticosteroid that helps calm down the inflammation that drives the asthma symptoms.
So this group of outside experts, they didn't support this combo inhaler for children under the age of 12. First, just tell us why that might be.
So this study took patients and divided them into three groups. They used moderate to severe persistent asthmatics, so kind of the worst groups, and had them divided into these three groups that used a medium dose budesonide plus albuterol, a low dose budesonide plus albuterol, and then albuterol alone as add-on therapy. They had over 5,600 patients, and what they found was a 26% reduction in the risk of asthma exacerbations, which is fantastic for these patients who are prone to exacerbations when their asthma is uncontrolled frequently. Unfortunately, with the younger children, with the ages 4 to 11, they were only submitted to the low-dose budesonide group. In this group, they did not find the benefits outweighed the risk of using it, so it was not recommended in the younger children.
So what might the side effects be?
Albuterol can cause shakiness, jitteriness, and palpitations. Those symptoms are typically mild and tolerable. Budesonide is a topical steroid, so it has very little systemic side effects. Thankfully, it does cause thrush, or it can cause thrush in the mouth, which is a yeast infection. So we encourage our patients to brush their teeth, rinse, and spit after using this.
So could it be on the market soon? What do we know about that, timeline-wise?
I couldn't find a release date, but I would expect these medications could be released in the relatively near future, which gives us additional tools for managing our moderate to severe persistent asthmatics.
Dr. Geer, thank you so much for joining us this morning. We appreciate you.
Thank you.
Thanks. A family history increases your risk of stroke, but so does smoking. The World Smoke Organization found someone who smokes a pack a day is 6 times more likely to have a stroke compared to a non-smoker. This happened to Jessica McClintock, who was told to stop smoking immediately if she wanted to save her life and be there for her kids.
I want to live. Like, I'm 33 years old. I have 2 kids and everything else, so.
This young mom feels like she's in a nightmare and can't wake up.
When I got the phone call about my little brother and then my mom, so.
A nightmare that began for Jessica McClintock with the sudden loss of her mother and brother, not to COVID, but during it. Then this.
After about a week, I woke up in the middle of the night and I had to have my brother take me to the emergency room because my head hurt so bad.
The pain was unbearable.
I wanted to commit suicide is what I wanted to do because it hurt so bad I wanted it to go away.
Jessica was admitted to a Wichita, Kansas hospital.
My grandma has had a stroke.
With a family history of stroke.
My uncle has had one.
It was now happening to Jessica.
If my stroke went for too long, I may not be able to drive ever again.
But it was more serious than that. Jessica was transferred to the University of Kansas Health System and was met by neurosurgeon Dr. Jeremy Peterson, where she received another scare. She'd have to immediately quit her 20-year smoking habit and undergo brain surgery.
I started bawling. I was like, there's no way. And then they have to cut this whole side of my head.
Dr. Peterson diagnosed Jessica with Moyamoya, a rare blood vessel disorder. Moyamoya is Japanese for puff of smoke.
And you can see how it gets this puff of smoke look, where it's got all these little tiny collateral vessels developing.
Dr. Peterson and his team successfully performed what's called a cerebral artery bypass to untangle the blood blockage to Jessica's brain.
I'm just ready for all this to be over with.
With surgery behind her, she's worry-free from stroke for now. And although legally unable to drive due to eye damage from the stroke, Jessica's just happy to be home recovering where she belongs.
That's all about I'm all about my kids.
And please welcome Jessica's endovascular neurosurgeon, Dr. Jeremy Peterson. Good morning to you.
Good morning.
Good to see you. And I'm certainly nice to see that Jessica is home finally recovering, and we kind of watched her through that journey. I have to ask you, because I had never heard of Moyamoya before, tell us what Moyamoya disease is.
Yeah, so Moyamoya disease is basically an idiopathic disease process of the two of the main blood vessels that go up to your head. We've got 4 of them, 2 in the front and 2 in the back. The 2 in the front get affected right as the blood vessel's going into the brain, and it starts to slowly narrow and close over time. We don't know exactly, why it develops. From a standpoint, we know that the blood vessel kind of starts thickening in the center of it, and that's what causes the stenosis or narrowing. And then the blood vessels that are around that area start to develop and try to enlarge to supply blood to that area that is not getting that blood flow that it used to. And that's where you get that imaging finding, that puff of smoke that they first described in Japan many years ago.
So I know you said still a lot to learn about it, but is it genetic? Might this been something that her mother could have had or her uncle could have had, since they both had a stroke in the past?
So it's not a common disease, especially in North America. It's like 1 in every million. In the East Asian population, it's a much more common disease, so 3 in 100,000. And so they've done some genetic studies, and there does seem to be some predilection towards female gender, with like 2 to 3 to 1, and there is some predilection for this East Asian population, and so they've studied the genetics of those. Unfortunately, what they have found is these genes or these foci that could be affected or could be related to it, but there's so many of them, and not everybody with that change actually develops the disease process.
Jessica had smoked for 20 years. We certainly cannot stress enough the need to quit smoking for a myriad of reasons, but certainly when it comes to risk of stroke.
Yeah, and so there's not a direct link between the smoking and Moyamoya necessarily, but we know there's very much a direct link between nicotine use, not even just smoking, just nicotine use, and your blood vessel health. The body's ability to heal the blood vessels, to prevent these other disease processes like stroke or aneurysms or bleeding in the head, are all affected by nicotine. And so for Jessica, it was very much a process where she needed to quit using the nicotine, not only for her own future prevention of stroke, but also healing from a surgery, letting those blood vessels heal up, and give her the best chance to not have this happen again.
And I did speak with her the other day, and she's doing very well. That is a very, very difficult thing to do in a stressful situation, to be told you have to quit smoking immediately, and I think she's doing pretty good, right?
Yep.
It just needed to happen. You said, although this is rare, it is common when it comes to pediatrics. Tell us why.
It's not necessarily that the rate or how often we see it is more common, but in pediatrics, them having strokes is just even more rare than adults. And so the reasons why kids have strokes, this is one of those main reasons why we can see kids with strokes, is because there's a juvenile form of this Moyamoya where they develop this narrowing of the blood vessels early in their life, and depending on the kid, some of them are able to make new connections or get blood supply to that area of the brain, and some aren't. And if they're unable to do that, they start having these little strokes or TIAs, and it's just very uncommon to see those symptoms in kids. Well, this is one of those disease processes in kids that show up when we see those symptoms.
And would you do the same type of bypass that you did on Jessica and other adults for a child, or is it a little different?
It can be a little different, especially for kids, because their blood vessels, depending on their age and size, can be much smaller than in adults. I would say for the pediatric population, it's more common that we don't do a direct connection of one artery to the artery in the brain, but we actually take the artery outside the head and just lay it across the brain. And over time, the brain develops these little connections that then help bypass in a more indirect way.
Okay, let's not talk about it. Let's show it.
Yeah.
That is more fun and more interesting. If we could roll this video, this is you
Yeah, so here's
performing
Jessica's surgery. So we're marking the blood vessel that's on the brain. It's very small, about 1 millimeter. This is the blood vessel coming from outside the head, and we're making a little cut in it to increase the amount of surface area that blood can flow through from the outside blood vessel to the brain blood vessel. And so we prep all that. We have to put little clips on the blood vessels to stop the bleeding while we're working. And so you'll see us put these little clips on here. It's all done under a microscope. These are all kind of micro instruments. And here's our little tiny scissors to open the blood vessel. And you can see we're suturing here with 10-0 suture, which is 0.002 millimeters in diameter. And so we're closing that blood vessel attachment from the outside blood vessel to the inside blood vessel that's on the brain. And so once this is attached, then we take those clips off and we watch the blood flow through that connection. And you'll see with our microscopes, we've got a special dye that we can give inside the veins. And the microscopes have a special wavelength that they look at after we put some kind of cotton hemostatic stuff on here. There you go. So now you're seeing that blood flow into the blood vessel from outside the brain into those blood vessel connections on the brain. And so essentially what we're doing here is, you know, glorified plumbing,
Yes.
but we're basically taking a blood vessel from outside the head, connecting it to a blood vessel on the brain that is distal to where that blockage is.
So a true bypass.
True bypass.
Taking the highway around
Yep.
the problem.
Yep. So we can't treat the problem directly. We can't go in there and balloon it. We can't take that area that's diseased out. And so this is one of our options of getting that blood flow around that blockage.
So once you do that, will it cause any further problems? You're not taking the problem out, but now that you've bypassed the problem, should that stay at bay for some time, or is there continued monitoring, I would imagine?
There's continued monitoring. There's continued concerns about having a stroke risk. That's why, especially for Jessica, stopping the smoking, stopping the nicotine is very important, because she's always going to be at a higher risk of stroke than other patients that don't have Moyamoya. But we think somewhere between 60 to 80% stroke risk in 5 years if you don't have a procedure done, versus if you have the surgery when it looks like it's symptomatic, we take that risk down to somewhere around 5 to 8%, somewhere.
So
in there.
is having a stroke what alerted you to her having Moyamoya? So she would never have known she had that unless she had the stroke, came to you, and you do some further investigating.
Yeah, so generally most patients don't know that they have this because it's not a common disease process, and especially in North America. And so most of the times they are presenting with stroke symptoms. Some patients can have ischemic stroke symptoms, which is more common in the U.S. version. The Eastern Asian Moyamoya disease, adults tend to present more with hemorrhagic disease, so they actually have bleeding in the head. At any rate, you still have those stroke symptoms, and that's how patients present to us. And probably really not even to us so much from the neurosurgery standpoint, but to our stroke neurology colleagues, our neurology colleagues out in the community. Sometimes they're primary care physicians or they're pediatricians, especially for kids. If they have these weird stroke symptoms that are like there for a second but then gone, but then they have another one shortly after, then that's when you start picking up these on this process, and then that's when imaging is usually ordered, like an MRI, and then ultimately these patients usually all end up getting one of those angiograms with the high definition pictures of the blood vessels of the brain that we do.
We discuss AVMs quite a bit on this program. I asked you, is this anything like an AVM? And you said, not at all.
Yeah.
Tell us the difference so that people, we hear about blood vessels in the brain and doing bypass surgery, but they're quite different in how they present.
So AVMs tend to present as a congenital lesion where the arteries are connected directly into the veins, and so you have a high flow arterial system into a low flow venous system, which again, it's still just all plumbing, right? So you don't want to take a high pressure system and put it into something that's not capable of handling that, because then what happens is that stresses out that vein and you start getting bleeding in the head. Versus this process is really where the pipes are starting to close down. So you're getting basically cloggage in the pipes and it's closing down, and so then the blood has to find another way to get to the brain. Some patients, their body does this naturally. They're able to make these connections and they don't end up having stroke symptoms. I know I have a few patients that are, into their 5th, 6th decades of life, and they were found they have Moyamoya just because they were getting pictures for another reason, and they end up not having symptoms. And so that's the part of this disease process where we just don't fully understand yet of why do some patients have a much worse course or not able to make those connections versus some patients that are.
We're getting a few good community questions. We're going to get to those in just a moment. I want to put a QR code, though, up on our screen that will outline some of the resources that we have available, and you can learn much, much more about Moyamoya disease. I want to take a quick check-in with Dr. Dana Hawkinson.
Yeah.
Find out our numbers today. We've got flu, RSV, COVID, you name it. Let's get to it.
It's a cornucopia of viruses today. So for the COVID count today, we have 15 active infections, which is good. That's going down. 1 in the ICU, 0 on the ventilator, still 20 in that recovery period. And then we also have some numbers for our RSV and influenza as well. So these are for our influenza positive tests. The important thing to note here is, again, this is just PCR. If you look way down at the bottom, you can see the total number of tests. Overall, the total number of tests have gone up since 4 or 5 weeks ago. They continue to increase, as well as the percentage of positive tests, really indicating that there is significant circulation of the virus in our community. So I think that's important to note. Again, right now for admissions as well in the hospital with influenza, before we get to RSV, is 13 adults and 4 pediatric patients as of last week. Luckily, there have been no influenza deaths at this point. And then for RSV, the number continues to increase as well. You can see there the total number of tests, and we've also parsed it out by adults versus pediatrics. Obviously, we know RSV circulates quite a bit in the pediatric population, but also in the adult population. And you can see here the trends are the same as influenza. The numbers of tested continue to increase, as does the total number of positives and the percent positive as well. So again, right now we are seeing an increase in the number of positive tests that are going on, indicating a large amount of circulation. I did speak with a pediatrician yesterday. We are maybe hoping for a early spike of that, and then a decline for RSV, because we know that our influenza will probably continue at least through the winter. So we're going to wait and see what those trends are, but I think right now there is still high circulation of the virus and the illness in our community.
All right, a study found monkeypox mutations are what cause the virus to spread rapidly, evade drugs, and evade vaccines. What does finding the mutation mean for possible future treatment or prevention of monkeypox?
Yeah, so this was a genetic study, really just looking at sequences that was done. It's really hard to say. It's an interesting finding. We know that current clinical studies are ongoing, but if you remember, there was an MMWR published about a month ago that showed even people with 1 dose of the Jynneos vaccine to help prevent monkeypox disease had significant improvement. There was only about 1 person who had disease compared to 14 who were unvaccinated that got the disease. So the vaccine still continues to provide really good protection. And right now, as far as we know, the TPOXX antiviral continues to work, but we're always looking for more. Again, we are still trying to figure out the real small points as to why this virus, this infection has taken off as significantly as it has within this spring and summer. But this is one more study just kind of looking at that information.
Any reporters on the line today? Let's get to our community questions. Layla says her son has Moyamoya, and she's curious if, Dr. Peterson, if you know if KU is performing any research studies around Moyamoya or where they might be able to find information about that.
I don't think that we currently have any clinical trials or any studies going on with Moyamoya. I know the Stanford group has a big Moyamoya group, as well as the Boston Children's group. So those groups may be somebody that would have something going on as far as genetic testing or some of that stuff, but I don't believe that we have any of those current studies here.
She's also asking if you're seeing more cases of Moyamoya over the years, or do you feel this is due to more awareness or other reasons? Just as we learn more, cases start to come to the forefront and we learn more, but what could you attribute that to possibly?
Yeah, I think in general, the disease prevalence probably isn't any more than what it's always been. It's just we are aware of it more. There's a much more knowledge and early response to stroke symptoms, and so people are educated on stroke and stroke symptoms now. And so I think that is just things that are picked up on much quicker. And so I think that's why we're seeing more of these patients. My population is biased because that's, ends up being my job. So those patients get filtered this way.
Sure. So. This Facebook viewer is asking if you could talk a bit about the partnerships with Children's Mercy. When we talk about children's cases, are you collaborating and working together to learn more and to take care of these patients?
Yep, so we work very closely with our pediatric colleagues at Children's. Our training program, our residents go through the Children's Mercy system. We have a connection between us and their IR department, and so we have very close work between us and them. I would say that's why we don't see as many of the pediatric patients here, and we're probably less likely to be in any of those big clinical trials from a the pediatric Moyamoya standpoint, just because a lot of that stuff gets over to our colleagues at Children's. But we work very closely, and like I said, the surgery that they do for pediatric patients is usually a little different than for the adults, and so they are more than capable and very good at taking care of those patients over there too.
Sure. Jim says, I have a family history of stroke. I did a 23andMe, and it says that I have some slight Asian ancestry. Any reason to be concerned? Would that be a reason to go see a doctor? Is there anything that they would be able to tell him that would be preventative?
Not really, outside of just your general blood vessel health parameters. So keep a good blood pressure, stay away from nicotine, make sure your cholesterol is in good order. Those general stroke prevention mechanisms are going to be your best thing. Like I said, even in the East Asian type of Moyamoya disease, it's still only 3 in every 100,000. So it's not even that it's a extremely common disease process for them either. It's just much more than in kind of North American descent. Now, if you've had TIA symptoms or stroke symptoms that then went away, at that point, it's probably not unreasonable for some kind of screening scan like an MRI. But in general, we don't screen for Moyamoya because it's just not that common of a disease. So if you think about it, if we did 1 million MRIs, which would be extremely expensive and bankrupt, a lot of healthcare facilities, we're going to find one person that has Moyamoya. So there's some part of, we don't have a good blood test yet or anything that picks it up that is not expensive and that is, easier for the patient.
So Emily was asking about screening for Moyamoya, which you just answered, but then Kathy said she's heard of a company that goes around and screens for potential strokes, so more broad stroke. Have you heard of that? Is that legit? Is that something When we say a company going
Yeah.
around, I don't know. Is that something you've heard of, or are we best to just go to our doc?
Yeah, that's not something that I've personally heard of, but I think it'd be a good question for our stroke neurology colleagues, and we work very closely with them. So I'm gonna ask one of them the next time I see them to see if there is something out there, because it's very interesting. Now, there are some companies or processes where people get screening carotid ultrasounds to look for blockages in the neck that then could lead to stroke. So there are screening things for stroke in general that are out there, but really not specific to Moyamoya that I'm aware of.
You mentioned this earlier. Kim is just jumping on and asking if Moyamoya is hereditary.
So there are some hereditary connections. So we know that there's a Moyamoya connection with things like sickle cell anemia. So those patients can have a higher risk of having this. Down syndrome, neurofibromatosis type 1. And so we know that those are genetic disorders in general, and so those patients seem to have a higher chance of having Moyamoya, and so there is some connection there from a genetic standpoint, but we don't have enough information about the specific genes for Moyamoya, because the ones they found, in the East Asian population where there was some genetic connection, there were lots of patients that also had that didn't end up having Moyamoya that was symptomatic or didn't have the disease. And so they call that incomplete penetrance. So we know that there's some genetic component, but we just don't understand why some patients that have that get it and some patients don't get it.
And why women over men,
Yeah.
might we think?
So there's some autosomal dominant characteristics of the disease there. So, some of those genetics may link itself to being more common in women, but again, the penetrance, even if you have it, doesn't mean you'll have the severe form or a less severe form, and so that's the part that we just don't have linked yet.
Great conversation. Such good information about stroke and the prevention and just a better understanding it, taking care of your own health. Let's get to our final thoughts. Dr. Peterson, what should we know today?
I think that's it. You just need to, keep yourself healthy. Try to get away from nicotine if you can. Go to your yearly primary care doctor's visits. That's probably the most important thing you can do for your health, because they can check those labs. They can, make sure that your cholesterol's in order, make sure you're on the newest medications. If you've got asthma and you don't know that there's a new medication out there, those are really the frontline providers that, help keep everybody healthy. So.
Thanks for being with us today.
Thank you.
Always good to see you. Dr. Hawkinson, final thoughts.
Yeah, again, we know these respiratory viruses are circulating. It's never too late to get up to date on your vaccines. If you haven't received influenza vaccine yet this year, please go get it. Get your loved ones and your family vaccinated. And if you are meet that criteria for the COVID booster, also go get that as well.
All right. Thank you all so much for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Have a great day, and we'll see you back here tomorrow at 8. More than 900,000 people call rural Kansas home. It's a growing population that relies on 98 community hospitals who deliver babies, provide emergency and other care. I'm Jessica Lovell. Join us for the next Open Mics with Dr. Stites to hear from medical experts prepping for an important meeting on workforce and financial challenges of providing rural health care.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.